Hey everyone, this is Dr. Ruscio, and what is the relationship between thyroid autoimmunity and thyroid cancer? Well, your fast facts on this issue are, if one has thyroid autoimmunity, the more severe the thyroid autoimmunity may indicate a higher chance of thyroid cancer, and potentially managing the autoimmunity or trying to get the antibodies as low as possible may have a favorable outcome. So what are some of the details behind this? Two studies were recently published examining this issue, and I'll link to those studies. And essentially these studies both found a relationship between thyroid autoimmunity and thyroid cancer. Those that have or had thyroid autoimmunity had a higher incidence of thyroid cancer. In fact, one study showed that if the thyroid autoimmunity was very severe, meaning the what's called TPO antibodies were over 1,300, shouldn't be above usually about 30 or 35, there was a greatly increased chance of thyroid cancer risk. Now, not all of the studies agree on this. There was one review paper that showed that some of this relationship might be overstated because of biases, meaning the researchers were expecting to find thyroid cancer and that produced a higher amount of thyroid cancer findings. Nonetheless, irrespective of kind of the academic debate or the controversy, which there's controversy in many things scientifically because it's very hard to prove one thing definitively. Forgetting about all that for a minute, what does this mean in terms of practical, actionable items? Well, it means that if you have thyroid autoimmunity, the approach of trying to manage or dampen or lower the amount of thyroid autoimmunity may yield dividends. Now, to my knowledge, there have not been any studies published showing that by trying to lower thyroid autoimmunity, one would decrease their risk of thyroid cancer. But we do observe that people with none or lower thyroid autoimmunity they seem to have a lower cancer risk. So certainly it would make sense to go through some of the strategies that we use to try to dampen or lower thyroid autoimmunity. This would involve diet. For example, the autoimmune paleo diet works very well. Second to that, some dietary supplements can be helpful, potentially fish oil, some antioxidants like selenium. And then third to that would be the treatment of any kind of infections. For example, there was one published study in Italy that showed when patients with Hashimoto's were treated for an H. pylori infection, the incidence of, or the severity of thyroid autoimmunity dropped quite dramatically. So I don't think we need to have a really extensive rationale to be able to say if you have thyroid autoimmunity, wouldn't be a bad idea to try to manage that as best you can. Now, I should also tell you that that is controversial. Your endocrinologist probably won't agree with the need to treat thyroid autoimmunity, which is fine. I mean, people are going to have different views on this. If you look in the functional medicine community, I think you'll see a number of clinicians who have a clinical experience similar to what I have, which is when someone has thyroid autoimmunity, which is non-managed, we will see thyroid antibodies usually between 7 and 1,300. And then when we manage this, the antibodies usually drop and hover around 1, 2, or 300. And that's important for me to mention because sometimes people come in not satisfied unless their antibodies are at 0 or below 30, which happens in some cases, but not in all cases. So I define successful thyroid autoimmunity management as having antibodies that hover maybe around 1 or 200, maybe 300, as opposed to between 7 and 1,400. So if you have thyroid autoimmunity, it may be important to address the autoimmunity in conjunction with taking medication if you need one, so that you're making sure to have adequate thyroid hormone levels and also making sure that the underlying autoimmunity is addressed, because it may affect more than just the autoimmune component of your thyroid. It may increase the risk for thyroid cancer. Okay, well anyway, this is Dr. Ruscio. Hope this helps. Thanks.